Well, we will get started. Well, welcome everyone. Good morning, good evening, or good afternoon. I'm Nicholas Torres, and I'm the president of the Network Towards Unity for Health. I want to recognize I'm joined here by Bill Burdick, who is our Secretary General of the Network Towards Unity for Health and has been part of, have actually brought TUFH and in its current stage, and also by Aricia Kemptener, who is my co-facilitator for this SNO leadership. In addition to tough, one thing about that I do is I teach at the one of the University of Pennsylvania here outside of Philadelphia. And one of the things we teach in the business school or the social policy school is how to inspire others to lead, envision, or divine innovations. We've also published a book in terms of like what is social innovations and how to put that could be a platform that could be applied to any institution. So we took that learning and then we said, can we apply it to the work that we're doing in TUFH, specifically the student network organization, and provide the students not only a voice within your own institutions, and why students is because they are the consumers of what you're providing to them. And with that, they have data, either anecdotal or real data of like how to make that experience better that would be meaningful for the students. So one idea was that they would have a student voice. But the second component was to think outside of their own individual data or data points, but also think across the institution. And so the institute we did was really about looking at the design of their ideas, the testing of their ideas, and we used human-centered design as an approach to really say, how do you test those ideas to make sure they're valuable to other students, but also to the institutions. And then in the testing, we did what was called sort of a rapid prototyping, was really going out and in a sense testing those particular ideas on real people. And so what we have today is really the final products of what the students have done across the globe within your own institutions. And so now I'm going to turn it over to my colleague, Aricia Kempner, who will serve as the Master of Ceremonies. Aricia?
Thank you, Nick. I'm gonna start by saying welcome to everyone, especially our students who have been working with us for the past months. I have to say that both Nick and myself were very impressed by the quality of the students and the capacity and the leadership that they were demonstrating throughout the projects. And I'm happy to share with you their final projects today. I'm going to start by giving you a 1 minute introduction to the Network Towards Unity for Health. If there are any of you on the line who have not heard or don't know our organization that well, the Network Towards Unity for Health, or TUFH for short, as we call it, we are international, we're intersectoral, and we're intergenerational, and we foster equitable community-oriented health services, education, and research with the goal of improving health. They call us often the network of networks as we unite and connect and convene healthcare organizations, universities, communities, institutions, and thought leaders from all around the world. TUFH is also a non-state actor with the World Health Organization, and we have three main roles, as you see on your screen. The first role, the biggest important one there, is called ISET for short, or the Institutional Self-Assessment Social Accountability Tool, which allows institutions to assess their social accountability. Our second role is all about global learning. One of the biggest pointers there is our communities of practice that TUFH has. We have communities of practice on women health, IDD, and autism, indigenous health, remote and rural health, migrant and refugee health, as well as aging health, where we are bringing together health workforce, educators, and students from all across the globe to work on these communities of practice. We also have our annual conference. The one that is coming up is in September of 2025 in Philadelphia. We also have international student exchanges, both in person as well as virtual, like our iStep program, which allows students to facilitate and to collaborate with students from across the globe while learning around climate change and social determinants of health. We also have two journals. Education for Health is our peer Medline Indexed Review Journal, which is up and running and has launched its newest edition in 2025. We also collaborate with the Social Innovations Journal, where we work on the social innovations that come from one of our fellowships. Which brings me to role three, which is all about local infrastructure and impact, making sure that what we do and what we have is being implemented on the local and cultural level, which we use the TUFH Centers of Excellence, which are basically mini TUFH headquarters who will make sure that the tools like the communities of practice and ISAT are being implemented locally in their region and in their culture. Sometimes that also means translating it into the local language. We also offer a variety of fellowships like the Social Accountability Fellowship, which is dedicated towards deans and vice deans and our leadership. We have the Tough Teaching Fellowship, which is dedicated to all our educators out there. We also have a mentorship program, and then we have the SNO Leadership Institute, which is where we are here today to really help grow our SNO and student leaders. I'm gonna stop sharing for this one, and then I have the honor of presenting to you the presentations of our students of the 2025 SNO Leadership Institute. The two first students that will be presenting their work are Zoe Perelstein and Valentina Stella Moriondo. I will be sharing the presentation that they have done for SNO Universidad Nacional del Litoral from Argentina. They are present, as you can see their smiling faces on the screen right now. So if you have comments and questions, you can ask it after the video. Here we go, sharing and go.
Good morning, everyone. My name is Zoe Perelstein, and together with my colleague Valentina Stella, we are both fifth-year medical students at the Universidad Nacional del Litoral in Argentina. We are here today to share a proposal that we believe is both timely and essential, an initiative to promote a smoke-free culture within our university. Our goal is simple yet powerful: to protect our academic community and our environment from the consequences of smoking by creating a healthier and more supportive campus atmosphere. We believe in a university that reflects the values of medicine and public health. To turn this vision into reality, we have identified a set of essential resources. We will need educational materials such as brochures, posters, flyers to promote not only smoking cessation but also broader smoke-free culture. We'll install durable signage in high-traffic areas. To make our workshops engaging and effective, we need stationery and audiovisual tools, as well as materials for digital campaigns and social media. We are also preparing cessation support kits, which will include visual aids and guides for emotional support. And finally, we plan to install environmentally responsible ashtray disposal stations. Now, let's talk about the current situation. There have been efforts in the past. Since 2018, some signage was installed, and there were attempts at raising awareness, but these initiatives lacked continuity. Signage was often poorly located or not visually engaging. There is no interdisciplinary educational component, no structure for cessation, and no real connection between institutional policy and everyday community life. Most importantly, there is no data being collected. That's where our proposal comes in, to bridge these gaps with sustainable evidence-based actions. Our initiative takes an interdisciplinary approach, broadening the focus to include not only just health, but also the social, cultural, and environmental consequences of smoking. We will build a system for long-term sustainability and replicability. We will increase and improve smoke-free signage, promote workshops on smoking cessation and healthy lifestyles, and encourage community engagement.
So how are we going to implement the project? Our main focus will be on education. Carry out several actions such as visual reinforcement, highlighting why we aim for a smoke-free School of Medicine along with a virtual campaign, extracurricular workshops referring to tobacco health, mental and social issues led by expert professionals. The topics will include smoking cessation, the effects of personal and environmental pollution, and the promotion of healthy lifestyles. Also, we will empower curricular content related to smoking in third and fifth year of medicine, and we will participate in the regional health meeting organized by the faculty. We plan to request $50 from the institutional budget. Additional funding will come from the Student Health and Wellness Program, and if more is needed, we will ask from external resources like local public health departments. From August to December 2026, our benchmarks include finalizing the project design, launching the project, installing signage, and beginning the workshops and virtual campaigns, participating in the regional health meeting, and collecting data and presenting results of the project and propose its extension to other university departments. Our team includes myself and Zoe, who coordinates the project, faculty, professors, and authorities who provide academic and content support, expert workshops speaker, and peer volunteers who help ensure the project's continuity and promotion. We are glad to present this project as part of an ongoing SNO chapter. We believe in building a smoke-free campus in a context of a culture of health, one that promotes a cleaner, healthier, and more inclusive learning environment. So let's lead by example for ourselves, our peers, and our future patients. Thank you.
Thank you.
Thank you very much to our first presenters. We have a lot of presentations to go through, so we won't have time for many questions. However, I can take one comment or one question out loud. The rest of you, please post all of your comments or questions in the chat. Is there anyone that would like to speak up? I'm seeing lots of applauses and hearts all around. So overall, I would say Zoe and Valentina, great job. And I, for one, am looking forward to seeing the results in December to see how it was, how it worked, and how you're going to try and implement it in the different other colleges. So thank you once again. Other comments and questions, please share them in the chat. I am now honored to present to you Ritvik Rao, who is also on the call today. He is from India, from Kahar's JN Medical College, and he will be presenting next. So I'm going to be sharing my screen again. Here we go.
Greetings everyone. My name is Ritvik Rao and I am an intern at JNMC and KLU Hospital, Belgaum. My project, Clearwell, aims to leverage IoT to provide clean drinkable water to the rural population of Belgaum, thereby increasing their standard of living and quality of life. We are currently at the idea development stage and we have attained informal backing from our university. We're seeking financial support to the tune of 35 to 45 lakh Indian rupees, which comes to around 40 to 50,000 US dollars. We need this to deploy 230 IoT based water quality monitoring systems in and around Belgaum in 23 villages. Our plans for the near future are to develop, test, and validate our prototype, as well as to apply for grants from research agencies such as BIRAC. The problem I'm trying to solve here is unsafe drinking water. As you know, in a country like India, which has limited infrastructure, especially when it comes to water quality monitoring, there can be a lot of contamination of drinking water, which will in turn lead to a lot of waterborne diseases like cholera and typhoid, gastroenteritis, and so on. These diseases can be easily avoided if there is a water quality monitoring check at the site. This is where my solution, Clearwell, comes in. We aim to have on-site monitoring with portable sensors such as pH, turbidity, chlorophyll, temperature, etc., which will then transmit this data in real time and have instant alert systems for drop in water quality. We expect to provide cleaner drinking water for the rural population of Belgaum, which will lead to improved quality of life and decreased burden on the healthcare centers of Belgaum, such as my hospital, KLE. Our business model is a public-private partnership venture, which will require seed funding for the pilot program, as I've mentioned before. We also aim to form partnerships with the local municipality and NGOs. We aim to optimize costs by using open source hardware and training existing local personnel. Coming to the operational model, our hardware monitoring kit will cost around 13,500 up to 20,000 rupees. And our team has come up with a phased deployment plan, starting with a pilot program in 2 to 3 villages with an estimated final coverage of 23 villages in and around Belgaum. Our long term sustainability is to be attained by the PPP model and further expansion to other districts. Our targets are in the first 3 months, we want to establish the pilot program and validate our prototype. In the following 3 months, we want to expand and form partnerships with the municipalities and the local government. And by 9 months, we aim to complete the Belgavi deployment program. This is the team. I'm an MBBS intern at Keli Hospital, as I've said before. I'm the former joint secretary of Keli's Red Cross division, and I'm also a member of the District Red Cross of Belgaum. My mentor is Dr. Sulakshana Baliga. She's a professor of community medicine here in JNMC. She's also the co-convener of TUFH of South India, and she has experience in publication and patenting of prototypes, as well as an expertise in AI domain. Thank you.
Thank you very much to Ritvik. That was another great presentation. It shows a very different side of community involvement and how to help, create a better and healthier world. Again, I will accept 1 or 2 people to ask a question or provide a comment. Everybody else can do so in the chat. I'm looking at our attendees. Is there anyone that wants to speak up? I'm seeing lots of hearts and lots of applause again. So again, I would say Ritvik, very good job. I'm very interested to see how you're going to be able to implement it and what the result will be in your region and potentially then other regions as well as other regions around the globe, which I think can take a lesson from this. So thank you again to Ritvik. And I'm now honored to introduce our next speakers who will be presenting the Northern Ontario School of Medicine University, Jaden Smith and Michaela Clio. Apologies for the pronunciation. And they will be presenting next. So here they are.
Hi there, my name is Michaela Cochimilio. I'm an incoming third-year medical student at the Northern Ontario School of Medicine in Thunder Bay, Ontario, Canada. And I'm here today to present our project for the student network organization called the Northern Equity Project, advocating for impactful change in Northern Ontario. Our pilot project is addressing pain management inequities in women's reproductive health. Why is this our first initiative? Women experience severe undertreated pain during IUD insertions because current pain management practices are inconsistent, outdated, and lack cultural safety. Inequities in pain care for Indigenous people are well documented and are perpetuated by systemic gaps, resulting in avoidable suffering and reinforcing mistrust in the healthcare system. Culturally safe, equitable pain care is overdue and non-negotiable. What do we need to get this project off the ground? Number 1, we need funding. This funding will be used to deliver the first year of workshops, materials, and community engagement sessions. Additionally, we will seek out mentorship for provincial and national funding sources. Number 2, partnership. We are hoping to form institutional partnerships with Nossum University and Lakehead University to help integrate our education workshops into student curricula. Lastly, support. We need guidance from clinical experts in women's health and Indigenous health mentors to ensure culturally safe care. Now on to the gap analysis. We have identified a significant gap in advocacy and education around pain management during IUD procedures. Our approach to this issue will include education, policy, advocacy, and community collaboration, as well as workshops and seminars. There has been no previous work done to specifically address the intersection of pain management, gender equity, and cultural safety. This SNO group would foster a long-term platform for advocacy and interdisciplinary dialogue and amplify student leadership in Northern Ontario. Plainly, this is our proposed solution, a student-led interdisciplinary advocacy platform that provides workshops and raises awareness, partnership with Indigenous communities, and advocacy for implementing evidence-based, culturally safe pain protocols. An example of some of the work we hope to do would be an information session run by healthcare professionals discussing evidence-based, equitable pain protocols and feasibility of implementation. Regarding funding sources, we will be seeking out funding from internal grants, which would be interest group funding from NASM University Student Council, NASM University Research Funds, and Lakehead University Club grants from the Student Union. External grants, which would include funding from the Canadian Federation of Medical Students and the Ontario Medical Students Association, as well as private funding, which would include private donations from local advocacy groups. The initial funding we need to get this project off the ground would be $200, which we will hope to seek from NASM University Interest Group Fund. So what are our milestones? From months 1 to 3, we hope to launch the project. So this will include establishing partnerships with Indigenous organizations, securing initial funding through internal grants, finalizing culturally safe workshop curriculum, and recruiting student volunteers and workshop facilitators. Months 4 to 6, this will be our pilot delivery. So we'll host our first pilot workshops at NASM University and Lakehead University, collect participant feedback on workshop quality and cultural safety, and begin developing advocacy materials, for example, policy briefs and toolkits. Months 7 to 9, this will be our expansion. Here we'll refine workshop materials based on feedback, expand workshops to additional Northern Ontario communities, and build connections with local health centers for wider delivery. During this time, we'll also apply for larger grants from the Canadian Federation of Medical Students and the Ontario Medical Students Association to sustain our scale up. Beyond the 9 months, this will be our sustain and scale period. We'll publish the workshop results and lessons learned, formalize a sustainable student-led advocacy chapter for ongoing leadership, advocate for adoption of culturally safe IUD pain protocols in Northern clinics, and share the model with other Canadian medical schools and Indigenous communities. Who is our team? As I mentioned, my name is Michaela Cochimilio. I'm an incoming third-year medical student at NASM University. I have a background in applied life sciences at Lakehead University, and my relevant experiences include quality improvement studies and qualitative analysis pertaining to obstetrical care in Northern Ontario. I also have leadership experience through holding leadership roles in interdisciplinary student-led organizations. My passions include women's health, health equity, healthcare provision in Northern Ontario. My counterpart, Jaden Smith, who couldn't be here today, is also an incoming third-year medical student at NASM University. She has a background of Algonquin mixed ancestry and a degree in biomedical sciences from the University of Guelph. Her relevant experiences include pharmacology research and community leadership through student organizations. Her passions include reproductive justice, equitable and culturally safe healthcare. Other NASM students and Lakehead University students will be encouraged to join and succeed us once we graduate with this SNO chapter. Thank you so much for listening to our pitch today, and we hope you enjoyed. Have a nice day.
Thank you, Michaela and Jaden. Another great presentation. I love and I hope that others who have not seen the presentations like Nick and myself can see the variety of topics that are all very unique and locally interesting and important, yet they all unite across the SNO universe, in some say. I have a question here in the chat from Duncan. So Michaela, you can unmute and answer. Is the pain so severe during IUD insertion? Have any studies been done before to identify this as a research gap?
Thank you so much for the question. As far as I understand, there's anecdotal evidence that IUD insertion pain varies from person to person, and there's not a lot that practitioners are able to do at this point. That's standardized across the board. So our project aims to fill that gap. Other than that, I think we need to do a little bit more of a dive into potentially some quantitative data on the topic. But thank you so much for the question.
Thank you. And as a woman with an IUD, very personally, I can say that yes, the pain can be quite severe. This is a personal experience, but I can guarantee you that it does hurt. I also have Frank who's lifted his hands. Frank, do you want to speak up or ask a question?
Oh, yes. Thank you so much, Aricia. And my concern is rather that in this project, apart from the data we get from the implementation, it would be nice if we get data from the patient experiences, because it is actually the target to make sure that pain is better managed. So maybe from knowledge and implementation, we could add in that aspect so that we also give this as one of the interventions that can be implemented in other societies if that data is published. Thank you.
Thank you, Frank, for the pointers. I'm sure Michaela and Jaden will take that into consideration. Well, thank you once again. Other comments and questions can be in the chat, and I will now introduce our next presenting team, who are representing the University of Jazeera in Sudan. They are Manasik Osman, Azil Magzoub, and Ahmed Al-Walid. And here is their presentation.
Assalamu alaikum wa rahmatullah. We are Manasik Azil Ahmed, medical student at University of Jazeera. Today we are so excited to introduce our network and mission, which will be presented by me, Manasik. So our project title is Resilience Network, Health Access, Research Conference, and Mental Wellbeing. As we know, Sudan crisis has left students and communities without care, support, or system to build from. In response, the Resilience Network brings students together to lead in 3 distinct but complementary sub-projects, which are SHAN, Sudan Health Access Network, which will provide essential care access to communities in conflict zone through both conflict zone and affected area, through both virtual clinic and up-to-date interactive maps to locate health service. We also have a Jazeera Research Conference, which will build research capacity for more data to guide intervention. Moreover, we have virtual mental health program, which will offer mental health support for medical students. So we can consider SHAN as an intervention and mental health program as essential needs for who will guide the intervention, and Jazeera Research Conference as a guide of these interventions. I hope the logo and tagline is clear for you. To make this vision a reality, we seek support in several key areas: funding, mentorship, and partnership. Funding, we ask for $20,000 for telehealth technology from NGOs and $30,000 for conference needs supported by University of Jazeera Public Relations Office, and $8,000 for mental health platform subscription from a mental health organization. Mentorship, we ask for guidance from TUFH, an expert in public health, trauma-informed care, and research conference. Partnership, it will be with WHO, Sudanese Red Crescent, mental health organization, SABA, universities, media, sponsors. Now let us understand the problem more deeply. We catch 3 major gaps created by Sudan's war, which are, first gap is access to healthcare is broken. As you know, clinics are damaged or unreachable. The second gap is mental health needs are rising for students, especially stress, trauma, and rest issues. Third gap is student research. There is no structured way to turn students' ideas into action or evidence. The Resilience Network fills all 3 gaps. The Resilience Network uniquely addressed the crisis through 3 integrated programs. SHAN, improve health access via mobile clinics, virtual consultation, and health service map. Jazeera Research Conference will empower students to generate actionable research based on real community needs and field data. Mental health program, deliver virtual mental health support to vulnerable population of students. Together, they create a closed loop of intervention, as you see on the figure on the slide. Financial model, we divided the required amount into 3 phases: before, during, and after the project. You can see detail with needs and amount on the slide. Regarding our business model, we can say that the Jazeera Research Conference will be the Kickstarter of the Resilience Network. And that is because we will schedule it with the University of Jazeera Golden Jewel in order to enhance promotion of the network. In short term, the Resilience Network will be managed by partnership between co-founders, SNO Jazeera and JAMSA. In the mid-term, it will be managed by co-founder and SNO Jazeera. And in the long term, it will be under the SNO Jazeera Annual Action Plan. When it comes to benchmark and milestones, we can say the first 3 months will be for promotion and preparation, and next 3 months will be for finalizing, and last 3 months will be for launching. You can find it more detailed on the slide. Beyond cycle is also figured on the slide. Team structure. We can say that the project supervisors will be co-founders, which are Ahmed, Asil, Manasik, and the project coordination will run through several coordinators. Project oversight and cross-program coordination will done by SNO Jazeera, and volunteer mobilization and logistics will done by JAMSA, Jazeera Medical Student Association. SHAN will be led by medical students and junior doctors in Jazeera University, public health intern will assist in mapping and virtual care. Jazeera Research Symposium will be coordinated by scientific committee of students and faculty. Research advisors will be university staff and alumni researchers. Peer-reviewed abstract system will also be found to ensure academic quality. Mental health program will lead through trained student facilitators under the supervision of Sudanese mental health professionals. We also structure support teams for media, finance, outreach, logistic committees, and public relations. Thank you for your time.
Thank you for SNO Jazeera. They have collaborated with the three of them amongst different projects they've been working on to create one network together. I think their initiatives and gaps are clear. Any comments and questions from anyone? Can see some posts in the chat for you guys to have a look at the Education for Health journal and publications related to your topic. Is there anyone else that has a comment or a question? Okay, then I am to thank our three co-presenters for this. Thank you to Manasik for the presentation. And I look forward to seeing how the conference will take off and how it's going to establish the full network. Next to be introduced is Noah Shidunidu Nweke from SNO Jazeera. He is representing Nigeria as a country. So here is his presentation.
Hi everyone, my name is Nweke Noah, the SNO Nigerian president. I'm glad to bring this initiative to you, which is mental health, fighting addiction and depression in Nigeria. Why this matters? Nigeria is facing a silent crisis. Depression and addiction are rapidly increasing among youth, especially in universities. Yet, the mental health support system remains dangerously inadequate. This project aims to confront this crisis head-on by creating awareness, providing early intervention, and connecting young people to professional care and peer-led support. In 2024, I had a deeply personal experience that reshaped my passion for mental health advocacy. A friend of mine, once one of the brightest students in her class, began to struggle academically. Her performance declined rapidly, she lost interest in the things she once loved, and her once vibrant spirit grew dim and distant. I later discovered she had been silently battling inner struggles. Without proper support or guidance, she turned to harmful coping mechanisms. And this led me to start asking myself these questions. What if there had been access to professional care? What if a school had prioritized mental health awareness? What if someone had noticed early enough? These questions continued to echo in my heart. Her story first my commitment to creating a system where no young person suffers in silence. The growing challenge in Nigeria. Over 75% of people with mental health conditions in low-income countries like Nigeria receive no treatment at all, according to World Health Organization 2023. 20 to 30% of Nigerian youths are affected by mental health disorders. Depression and addictions are the leading cause of disability amongst adolescents. 1 in every 5 youths battles with a diagnosable mental health. Less than 1 psychiatrist per 500,000 people in many African communities, according to World Health Organization Mental Health Atlas 2020. Among all, stigma, cultural beliefs, trauma, and poor coping skill often leads youth to substance abuse and prevents early intervention. Our solution will be through awareness campaign, peer support network, anonymous helpline, and through referral system. Our initial asking to kickstart this initiative is 1,000 USD, and we're going to have a strategic partnership with mental health institutions, media platforms, and schools. How the allocation will be used. 25% of this allocation will be used on educational materials to design and print awareness materials. 25% will be used on ambassador training, and 20% will be used on helpline groups and other miscellaneous activities. 30% will be used to host 5 major university outreach events. The sustainability plan will be through voluntary-driven, through grants, corporate social responsibility partnerships, and through premium mental health training programs. The key milestone here will be In the first 3 months, we're going to launch this initiative in 3 universities, train 30 ambassadors, and set up helplines. In the next 3 months, we are going to reach out to over 5,000 students and host 5 major university events and partner with at least 2 mental health clinics. In the next 3 months, we are going to expand to 5 more universities, publish Empower reports, and launch digital platforms. Beyond, we are going to host national summits, youth mental health, and subsequent SNO team leaders who will take over this project. Here are our dedicated team leaders, our core team driving these initiatives. And here also we have our partner, Nigerian Health Watch. They're known for public health advocacy and renowned for data-driven campaigns. They will be providing us with technical expertise, media visibility, and health system linkage. Thank you.
Thank you to Noah and his team from SNO Nigeria for that important mental health campaign and program they're going to be running. If there is any comments or questions, please put them in the chat. I will make sure Noah gets back to you as he is taking an exam right now. You are still students after all, so schooling does take priority. So we wish him well on his exam. And then I have the honor of introducing our next speaker, who is representing our region, the Emro region, which is Rawan Said.
Hello everyone, I'm Rawan Said, a fourth-year medical student at University of Jazeera, Sudan, and IMRU's regional representative for the 2025 term. My project is titled Interprofessional Education for the Nations. It's a multinational approach that aims to implement IPE into SNO local chapters at the regional level. The asks for this project have been divided into 3 categories, as you may see. I would like to start by discussing the documents and materials. For the documents and materials, we'll need access to a professional Zoom account as well as access to prepaid online research databases. Along with that, we'll also need access to university facilities for our bi-monthly meetings and tri-annual events. For the human resources, we ask for 2 or more faculty members from each health college for administrative and collaborative tasks. A minimum of 1 student from each health college is needed for creational and manual tasks. Along with that, 3 to 4 interprofessional education advocates are required to facilitate the programs. I ask for $1,500 in funding for each local chapter for a professional Zoom account subscription, fees and staffing, marketing and promotion, logistics and printing, and online access to resources. Now on to the gap analysis. The problem addressed by this approach is the poor communication between students of various health colleges. This prevents interprofessional exchange, which is needed for career development, as it is inevitable for these students to face, interact, and work with each other post-graduation. So why don't we cultivate them to start that pre-graduation? The problem is solved by involving local chapters in the IPE for the Nations program. Each local chapter would be provided with an IPE plan, which would later be customized to the local chapter's needs. Each plan includes IPE definition sessions, workshops encouraging IPE, and networking events to implement IPE into real life. National and regional collaborations will then fall into place. Our financial model includes faculty funding, attendance fees from the programs hosted, Macy's Foundation's National Center for IPE, and Interprofessional Global's ANIC. Our milestones have been divided into segments of 3 months each. First 3 months, signing local chapters and scouting for facilitators. Second 3 months, hosting IPE introductory sessions, beginning networking events, and working on resources. Third 3 months will include the IPE project planning at each local chapter. Fourth 3 months will be the tracking the success of the IPE approach and planning for the regional collaboration. The fifth 3 months and marking the beginning of the second year will be the execution of the regional collaboration, as well as promoting for new local chapters to join. Our team involves interprofessional education organizations, faculty members, members of student organizations, SNO IMRU, regional administration, as well as the national teams. This team will be led by the SNO IMRU regional representative, along with the support of the regional team if present. Activities, however, at the level of a local chapter will be administered by the local chapter itself, only surveyed by the regional management, but large-scale events, including collaborations, will be managed by the regional representative. This team allows large-scale, experienced, and thorough execution of the IPE for the nation's program by using multiple resources, knowledge levels, and collaborative efforts for the regional benefit. Our success scale includes enriched student circles, increased student participation, student subscription increases in the program, as well as hopefully implementation of the program in real life health sector post-graduation. Thank you for your time. I hope we can all benefit from this program and that we can actually execute it and see the fruit of it all. Thank you.
Thank you to Rawan. This is the only regional representative that has participated in the SNO Leadership Institute in 2025. So her project, as you have seen, is overlapping with different SNO chapters all around the globe. So it brings a different perspective than others you've heard so far. But we're very interested to see how SNO EMRO is gonna put that into action. I'm looking if there's anyone here that has any further questions. I can see in the chat, consider offering a student IP team at a clinical setting to model collaborative care as well. So that's one of the pointers for you to take away, Rowan. And then lots of hearts and applause. So overall, very good job. Thank you so much. I'm very excited to introduce our next speakers, who are Yasmin Doma and Alia Medhat Ahmed Mahmoud, who are from the Suez Canal University in Egypt, and they will be presenting now.
Bringing life to our healers, SNO chapter in Nashta, and I'm Alia Medhat, intern doctor at Suez Canal University Hospital.
And I'm Yasmin Doma, an intern doctor at the same hospital. So pay attention, we are making better lives for our future healers.
Our ask is, we ask our faculty administration for the approval papers, collaboration with engineering faculty for making the software system, assigning us with psychiatrists, trainers, advisors, and making meeting spaces and supplies and logistics available.
We also ask the private sector for a fund to expand our work and hire new personnel, and we ask the universal health insurance for regular tests for the residents and the charity work for donations and grants. So the problem for our undergraduate students is that the current student engagement initiatives and activities has a gap between what actually students need and what they provide them. So we can solve that by a comprehensive student networking system.
Our problem for the postgraduate part, or especially for residents, is that residency is not an easy part. It is the first part or first step into the career. And residents are facing two things. First, load of work, especially if the infrastructure and logistics are not founded or not. The second thing is load of people interaction. They are the first line to encounter patients, relatives, referrals from other departments, and co-admissions would put them under pressure of interactions with different people with different personalities. All of this loads put them under psychological stress, which needs a network to relieve. And because we know that medical life is tough, we want the residents and the undergraduate to live every moment and enjoy it, not to postpone their lives.
So we are dealing with 2% of those who join university each year, representing the medical field. First phase for the medical students and the second for the other faculties. And we also dealing with the university students at the beginning of their life and the residents at the beginning of their career. So our aim for the undergraduate network is to provide the students with a peer support in addition to an academic one. Also to provide them with the mentorship opportunities in different fields, especially in research, and to develop their soft skills like leadership skills, and provide them with a collaboration with other different hospitals and students activity, and provide them with a community engagement activity and improve their communication chain. This all will lead to an enhancement in the university image.
Our solution for residents is the following. We are going to relieve their psychological stress through software application. This application will include the following. We will have mental health coach to track their psychological health, and this will be followed up by psychiatrists. We will also track their physical health through checkup for their daily vitals and making regular lab checkups every 3 to 6 months. We will announce short seminars or webinars through our application to give them tips and tricks about management and how to relieve the stress. We will make offers and deals with the small startups to give them or provide them with daily services like laundry and healthy food. And finally, we will make subgroups in the application to allow easy communication between residents, whether paging on-call residents or to deal with different things in life.
So our expenses will be spent on the personal hire, software preparation and spaces, promotion material, events and logistic training. And our revenue streams at the first phase will depend on the faculty budget, private sectors, grants and donation. And in addition to in the second phase, we will expand it to a participation fees, workshop events, merchandise sales.
For our milestones in first 3 months, we will finalize our financial plan, complete our team and the pilot study. In next 3 months, we will complete our software and finalize the deal with the investors and sponsors. And in the last 3 months, we will start our execution.
And finally, thank you.
Thank you very much to our co-presenters, making the life easier for most of you on the call who are students and future healthcare professionals. So I think it's a great idea and it is an important topic as well. You see lots of applauses and hearts all around. I'm looking at the chat, looking at the cameras. Is there anyone that would like to comment or provide a question, anything like that? Seeing none, I will say that everybody is amazed with your proposal, and I look forward to seeing it implemented at Suez Canal University, and maybe it can be implemented at other local universities in Egypt as well. So I am honored to move on to our next presenter, who is already on camera, I can see, who is Saida Taha from SNO Afat University in Sudan, and here is her presentation.
Assalamu alaikum. Hello everyone. My name is Saida Khatib, fifth year medical student from Ahfad University, presenting to you today my project Collaborative Care Network towards enhancing medical knowledge and services in Sudan. I am from Sudan, a Northeast African country that enjoys one of the most established medical education systems, producing skilled health professionals who serve both locally and globally. With these enthusiastic health professionals and strong academic legacy, Sudan can be actually positioned to be a regional leader in innovation, technology-driven healthcare education. However, with the events of the past 3 years of conflict, preceded by the COVID-19 and the country economic and infrastructure, we're still facing some challenges like most African countries, with the insufficient clinical exposure and the health inequalities in itself, specifically in rural areas, involving students in accreditation efforts, integrating technology and research capacity across medical universities, considering the very fragile infrastructure of technology in Sudan, and also clinical training, considering the current conflict events that disrupted the health system in itself. So why now? Sudan needs us now. Sudan is going through a recovering period that needs its youth and health professionals to actually contribute to the development of the health system and reestablishment of this disrupted system. Through this program, I aim to reduce health inequalities, increase graduate competence through their clinical experiences and medical education. Considering the right platform and partners, bringing them together, we can transform these current challenges into a resilient connecting medical education model for Sudan's future doctors. So, how? Through the Collaborative Care Network, a mentorship-based digitally supported platform connecting universities, hospitals, and students to advance their quality education, adopting the ECHO model, a global ECHO model that has been tested throughout the globe. It stands for Extension for Community Healthcare Outcomes, that believes in transferring knowledge, not people, using technology to leverage scarce resources, share best practices through case-based learning to master complexities, and utilizing a web database that preserves materials and keep it for future share. So the project scope will be mainly around mentorship and experience sharing, connecting the three entities: universities, hospitals, and medical students and staff. So my plan for the first year will be to bring in essential partners who already adopting ECHO model in Sudan, like the Dongola University and Jazeera University, and also establish knowledge hubs in SNO chapters in different universities, starting from Ahfad University, of course, and connect these hubs together to initiate the learning processes. The expected outcomes will be around that students will graduate more competent and confident regarding their knowledge. Faculty mentorship and knowledge sharing will expand regionally as I aim to include SNO chapters from other countries. Hospitals and universities who are experienced will be serving as an excellence center to share their competencies and experiences with less experienced entities. And definitely this model, we would like it to be sustainable, and we will work hard to make it sustainable digital infrastructure for medical education in Sudan. So project team will be me, Said Al-Khatib, leading this project. And through the past period and initiation of conversation with implementing partners, SNO chapters in Jazeera and other universities, definitely receiving support from as mentorship and technical support from SUDRO, a national organization that adopted this model for the first time in Sudan, and ECHO Institute, who also provides rigorous local support for those who wants to adopt such a hub. And definitely partner institutes, university medical faculties, and teaching hospitals. So I would like to invite you to join me in advancing medical education and services in Sudan. For my faculty, I would like to ask for this project endorsement to be a scalable innovation in Sudanese medical education, help in assigning faculties to join as subject matter experts and mentors, support technical setup of these hubs through providing lecture halls and digital infrastructure in university, and integrate this program to be part of the educational improvement. Definitely, this program will need a financial support. So for the first year, I aim to just utilize the existing infrastructure and utilize the existing partner support that provided, and fundraising efforts if needed. Thank you for your attention. Any question, I'll be present in this presentation.
Thank you, Saida. That was a great presentation. I see lots of hearts and fires and clapping all around in the chat, so everybody's impressed. I'm very intrigued to see how you're going to implement it, and I am very excited to see how your institutional leadership, the professors, the deans, the vice deans will collaborate with you in implementing a SNO chapter at Ahfad University with this as its main project. So thank you so much. I'm looking if there's any particular commentary or question, but I see lots of proud and good jobs out there. No particular questions. So I think everybody's very interested to see how you're going to implement it, and then how we're going to expand it perhaps to other SNO chapters across the globe. Thank you very much, Saida. And then I now have the honor of introducing Frank Kayemba from Busitema University in Uganda.
If you wish you had started your research journey earlier, join me as we make that possible for others. I'm Frank Kayemba, a medical student at Bositema University in Uganda. We are launching our SNO chapter with a project that we've called the Student Research Lab. This project is aimed at equipping undergraduate medical students with research skills in a sustainable way, because institutions are more of a pipeline. Students are coming in as others are graduating. So without a structured program, we always get a deficit whereby students have to start from scratch because the others who had the skills have graduated. My ask is $350 annual funding, $2,000 annual grant allocation, and 12 skilled researchers to offer training. So far, we have the 10 researchers, and we are seeking for more too. Undergraduate research has been started. It's a lot of advantages to it. It increases critical thinking, innovativeness, it increases social accountability, and even shapes career choices. Students are very eager to learn. I've been getting at least a dozen of students every semester approach me to be mentored in research, but neither do I have the time nor the resources to do that on my own, and that birthed this project. So we are going to be doing a structured training that happens twice a year. It takes about 3 months, and it is done on the weekend as online sessions, which shall be taking 2 hours, and actually it will be every other weekend on a Saturday. So that accounts to 6 weekends in the 3 months, and we shall recruit 50 students with a target of 50% completion. The sessions shall be delivered by researchers, and the program shall end in an essay writing competition. We hope some grants to fund a few projects that would come from this training. And it will be sustainable in that we have funding from the faculty to enable the administration of the project, and students from previous cohorts shall be able to lead the training of the following cohorts. This is the financial model. Every student who wishes to join SNO shall have to pay their own subscription, which is about $5 in 3 years, very affordable. We are seeking $350 from the institution, and that will cater for graphics and branding, administration support, and the student essay writing competition. We seek $2,000 from the faculty as a grant allocation for undergraduate research, because usually they allocate grants, but they put so much money on them, like $10,000, and rarely do students have projects that consume that much money, nor do they have the reputation to get it even when they have the projects. So, so far we have started the planning for the cohort of this year, which shall be one cohort because we're already in the second quarter of the year. We shall be onboarding students this month, and the training shall start September to November. By December, we shall be evaluating our performance in the first cohort and planning for the future cohorts. 2026, we shall have the first cohort running from January to April, and the second cohort from August to November. This is the team. I, Joshua, and Jonathan, 5th year medical students. We are finalists, and we've been involved in research for the past couple of years with a few publications and skills from data analysis to doing systematic reviews. And the other colleagues are representing the other programs that we have in the university. Michael is representing the medical students, Martha, pharmacy students, Stephen, nursing students, and Jemba is representing the anesthesia students. So together, this is our team, and we hope that we shall make this possible.
Thank you, Frank. Any comments or questions? I'm looking at the people. Another great presentation, completely different subject, although related in some sorts of the research aspect. So again, I think for students particularly, it's going to be very interesting to do this. I see here that Bill posted a comment saying, consider an initial component of community input to help determine research questions. So Frank, I'll leave that for you to consider. Seeing lots of applauses as well. So again, a great presentation. Thank you very much, Frank. Our next presenters will be from Latin America, but as this is a very long session, I'm going to ask everybody to work for your own mental and physical well-being, to get up and do just a 1-minute move around, stretch your legs, move your arms, feel that you are activating yourself, because it's often with these sessions that are virtual, we often get the tendency to kind of, get in a slump and get tired. So make sure that you stretch and activate yourself so that you can pay attention to the next presentations, because I guarantee you they're worth your time and effort. So now that we all feel re-energized, I have the honor of presenting our new presenters, who are Flaviana Albuquerque and Mirella Villanova. Here is their presentation.
Hi everyone, my name is Flaviani. I am a nurse and I am a Master of Science student in nursing. I'm here to present the project Mental Health Education for Inclusion and Prevention. This is a university extension project that trains students to promote inclusive and preventive mental health care, especially in vulnerable communities. I believe deeply in the power of knowledge created between the university and the communities, and the prevention as a raw strategy for improving health. Today, we're asking for support to help formalize the project inside the university and access basic resources, like a space for meetings and educational materials. We are also looking for future collaboration to provide students scholarship through university programs or external funding.
Hello everyone, my name is Mirella. I am a psychology student and I will be continuing the presentation. What we have now in Brazil is that not everyone has access to quality mental health care, especially people from marginalized communities. Even though our health system is built to include preventive actions in threats, the prevention often doesn't happen as it should. Besides that, what we have is that every day many students in health courses also graduate without real experience working with vulnerable people. Our project responds to this gap by training psychology, nurses, and medicine for beginning students to act in the community with a focus on cultural sensitivity and social justice. They will learn directly with professionals and teachers and then act in the community with guidance and supervision. These prepare future health workers who are ready to listen, care, and act preventively. This is a public university extension project focused on mutual learning and social impact. It doesn't aim to generate profit, but it supports educational and health equity. What we have for plan is that we will start with a selection process to invite students to enter the project. After that, they will pass 3 months working and learning about interdisciplinary training based on 3 models with professors and professionals. For the next 3 months, they will act in the community in partnership with local health service. After that, experienced students will lead new groups. So this way, the project still grows while staying connected with the real needs. If we succeed, the impact will be real. Students will become more prepared and socially responsible professionals. communities will receive more attention, care, and preventive support. And after that, the university will play a strong role in solving real problems connected with the reality. We finally want to build a bridge between knowledge and care with inclusion as its center. Finally, this is our team. And together, we bring academic knowledge and practical experience to build a strong interdisciplinary team. Our shared goal is to prepare students to act with cultural competence and to promote mental health care in the real world. Thank you for listening.
Thank you to our team from Universidade Federal de Pernambuco. They are on the call and happy to take any comments or questions. So I'm looking at the chat, I'm looking at the videos, and again, I see lots of hearts and applauses, lots of hearts. So I think your idea is very much loved with the general population. So I would say very well done. Great job, good collaboration. And I look forward to hearing from you guys in a couple of months to see how the implementation goes and how we can maybe adapt it for other SNO chapters to do as well. Thank you, Flaviana and Mirella. I now have the honor of now introducing SNO Bangladesh, which is Proga Parmita Roy. So here is her presentation.
Hello everyone, thank you so much for having me. I am Proga Paramita Roy. Currently, I'm a 5th year medical student from Dhaka Medical College in Bangladesh. Today, I'll be presenting my project titled Connecting Student Voices Across the Globe, establishing a new SNO chapter in Bangladesh. So over the next 5 minutes, we'll be going over these topics and project objectives. So the first, although in Bangladesh there are institutions and organizations that are for the medical students and for nursing students individually, there is no such organizations that can connect all these life science and healthcare students together. So to establish a network of dedicated youth, a young group from health and health sciences, we will be establishing this project. So after achieving the mission, what we want to achieve is develop leadership among undergraduate health care and life science students with a view of achieving health equity with a collaborative and research driven. For the benefits, we have subdivided them into for the students and for the institutions. So a young student can get a common platform where they can get their ideas shared, interdisciplinary approach from their undergraduate education level, and exchange of international resources to other SNO chapters. For institutions and their benefits, introduction and exchange of international endeavors at their own campus, representation of these implementations at annual conferences, international conferences, multidisciplinary action towards achieving health equity and health for all policy, evidence-based policy which can ultimately go into decision making. So what are we asking from the TUFH? As this is a very new initiative, we'll be needing official proof from the TUFH and of course from the SNO for procedural assistance for getting endorsements from the individual universities. Supervised training all throughout this project until formation of the new SNO chapter, and ultimately guidance until it's published in the TUFH journal. So this is the operation model. It will be run under the name Connecting Student Voices Across the Globe with the aim of establishing a new SNO chapter. This will be a supervised research training comprised of undergrad science students with representations from the following, like medicine, dental, nursing, pharmacy, and other healthcare institutions. For communication with individuals and international facilitators, we'll be using social media, and for intercommunication, we'll be also using WhatsApp. So the project will be run for 9 months. For the division of perfectly achieving our final goal, we have divided this project into 3 trimesters. For the first trimester, we'll be using the team formation, and what we'll be doing is finalizing the whole team and having proper representations from perfect institutions. For the second trimester, we'll be focusing on gap analysis and ultimately going to a research protocol. And after that, network and outreach. So we have proper representations, a minimum of 20 institutions under the United Grant Commission, which gives basically endorsements to different universities in Bangladesh. For the third trimester, we'll be drafting the final manuscript, which will be ultimately going into the TUFH journal. As it's a very new initiative and no other things have been introduced yet and not many people know about it, we will be using the free resources like the Google Workspace and Microsoft Sheets and Documents, and for work progress we'll be using the Notion. So this is the team, the very initial team. I myself will be leading this team as a project lead, and we have selected 3 project coordinators. First of all is Aisha Siddiqa Isha. She's a 5th year medical student based in Dhaka. What she brings to the team is her interpersonal skills with communications and public relations skills at her for this project that is very necessary to communicate and establish those connections and maintain those connections. Next up is Famila Jan Anika. She's also a medical student based in Dhaka. What she brings to the team is the external affairs ability she has shown in many national and international conferences all over the world and in the country. Last but not the least is KG Shubono Bithi. She is the engineering student from the Bangladesh University of Engineering and Technology, and what she brings to the team is her analytical mind. Through that, we want to achieve the evidence-based policy that we're actually aiming for after finishing up this project. So this is all. Thank you so much for listening to me for the past 5 minutes. It has been an amazing journey talking with you, working with you and under your guidance, and hopefully we can continue this collaborative relationship for the rest of our lives. Thank you so much.
Sorry, I've been speaking to myself. It was very interesting, but now I am unmuted. Great presentation. Thank you, Progra. I was saying that it is very interesting to see the establishment of the new chapter and really being, involving different institutions. And I think it's interesting to see, as you have from the past presentations, all these new SNO chapters that are being established, and how you can imagine that if the establishment goes well in the next, let's say, year or so, in a year and a half, we can really imagine what the cross collaboration could be like between all of these SNO chapters who have sometimes similar focuses on the topics that are there. So I'm looking at the chat. I can see that there's different comments from a bill that have been made for Proga for her to take into consideration. I'm looking at the camera and the chat. Anyone else that wants to speak up or type? No. Again, I see very happy faces, so I think all was well. I will now introduce our speakers for the University of Sharjah at the United Arab Emirates, who are Shaika Al-Kahaje, Salim Youssef Abdallah Al-Mula, and Hind Al-Khalaf.
Hello everyone, today myself Sheikha, Hind and Salim are going to be explaining about the initiative of SNO Sharjah, Medibox, Your Health Within Our Reach. By integrating the students' perspectives, this initiative ensures the real needs are actually met, creating a healthier, more inclusive environment at the University of Sharjah. Because students often lack easy access to over-the-counter medications and essential health supplies, especially during late hours, this leads to untreated symptoms, reduced well-being, as well as missed classes. We are seeking 150,000 dirhams funding for pilot launch, partnerships with pharmacies and tech providers. This is supporting phase 1, including 3 machines, a prototype, and 6-month trial at 1 campus, as well as technical and regulatory mentorship. Our gap analysis is the lack of students' easy access to over-the-counter medications, especially during emergencies, reducing their overall well-being. Existing campus clinics have long waiting times and limited hours. Off-campus pharmacies are inaccessible during late hours for dorm students. Students need privacy and convenience when accessing their health products, and no current system integrates the smart technology and healthcare access directly in dorms. We're going to solve this problem by providing 24/7 access over-the-counter medications. Due to that, it's actually avoiding the overprescription risk, AI recommendations for products based on their symptoms, supporting multilingual interface, placed in multiple regions in the dorms and on campus, environmentally friendly by having a recycling bin for any expired medications.
launch Medibook successfully, we need two things: money and resources. Financial support has to secure smart vending machines, stock them with essentials like over-the-counter medication and menstrual kits, and hire high-tech experts to build an AI-powered app that connects to those machines. Our business model focuses on efficiency, reducing hospital visits for minor issues by making health supplies accessible anytime, especially in student dorms. For Redaview, we're looking at potential partnerships, maybe with insurance providers or camper vendors. Funding can come from the university grants, health organizations, or even tech sponsors. We'll track progress with clear benchmarks, starting from the prototype testing to full campus rollout. Our team is made up of passionate students from the SNO Sharjah, each bringing different strengths. Most importantly, Medibox isn't just about health, it's about supporting students' academic focus by ensuring their basic medical needs are within reach. To keep this going, we plan to collect feedback through surveys and QR codes near Medibox. Plus, a student health ambassador will lead a mini campaigns and help younger students continue the project even after we graduate. This isn't just a one-time solution, it's a student-led platform that grows within tomorrow's needs.
We've outlined a phased plan starting with design and pilot testing in July to September 2025, and by early 2026 we'll scale to more campuses and introduce wellness subscriptions. By mid-2026 we'll be focusing on performance monitoring and preparing for a large rollout. And then beyond April 2026 we plan to expand across the UAE, add telemedicine and build strategic partnerships. This slide shows our core belief that students can't focus academically if their health needs aren't met. Medibox ensures access to essentials like painkillers and first aid, helping students stay in class and perform their best. Our team is cross-functional. I bring medical and leadership experience. Hind leads tech and operations, and Sheikha handles user engagement and marketing. Together we cover all aspects from design to implementation. This slide shows our core belief that students can't focus academically if their health needs aren't met. Medibox ensures access to essentials like painkillers and first aid, helping students stay in class and perform their best. Over 2,000 dorm students face health issues like asthma or menstrual pain, but clinics aren't always open. Medibox ensures fast access to basic health supplies when it's needed most.
And of course, to ensure the continuity of the SNO chapter, we will provide surveys and QR codes next to Medibox to involve the student's voice, establishing the student health ambassador and communication between different tiers, as this isn't only about solving a problem we have today. With the launch of SNO Sharjah, we're building a platform for student-led health solutions to continue to evolve with the needs of tomorrow. Thank you.
Thank you. Another great example of great teamwork, as we have 3 teammates working together to present something very unique and new. I'm looking at the chat and the screen. I'm seeing thumbs up. I'm seeing applause. I'm not seeing any particular questions. So I think, like myself, they're very intrigued to see how you're going to be able to create it and implement it. I think this has the potential to grow far beyond even what SNO chapters will grow to be, but even in the other global atmosphere and university campus life for students' well-being. So thank you to Shaika, Salim, and Hint. I now can introduce our next 2 speakers, who are Alex Ayaneboyona and Ikuzwe Shave Rosin from the University of Global Health Equity in Rwanda.
Good morning, good afternoon, or good evening to you all, depending on where you're joining from. We are Alexa Ineviona and Lozin Shabi Kuzwe, senior medical students from the University of Global Health Equity, UGHE, in Rwanda. And today we are excited to share with you our initiative developed through the Network Towards Unity for Health, the OSCE Ready Sprint Kit, or simply ORS. ORS is a bold, homegrown innovation designed to boost clinical confidence, enhance quality learning time, and strengthen competence among Rwanda's future doctors, built around the tagline "Prepare Smart, Practice Local, and Sprint in OSCE." What are we asking for? We are seeking 10,000 USD seed fund to create high-quality content, develop a functional website and mobile app, print the first batch of sprint cards for use in medical libraries, and cover operational costs. In addition, we are seeking strategic partnerships with academic institutions, medical educators, and aligned organizations, plus expert mentorship to ensure technical accuracy, evidence-based content, and contextual relevancy. So far, we have pitched this idea to the chair of the UGHE Innovation Center and received positive feedback. And we have built a prototype website to begin testing. What problem are we solving? Despite receiving world-class training from global experts at UGHE, students still face a lack of accessible, high-yield, and locally contextualized resources for OSCE and Viva preparation. Second, there is inconsistent preparation approaches across institutions in Rwanda and the region. We want, therefore, to democratize access to effective clinical learning tools, not just at UGHE, but for all medical students and assessors across Rwanda, Africa, and beyond, by strengthening peer-centered learning and improving standardized clinical exam preparation, and aim to increase success rates and eliminate failure and retake rates, which is high according to a regional study by Kibuka. Therefore, here is our vision for the solution. ORS will offer modular system-based sprint kits, both online and hard copy versions, interactive sprint cards, which can be gamified for peer-led sessions, AI-enhanced learning features to keep pace with advancing medical technology. These tools will make accessing and practicing key clinical concepts for OSCEs equitable, easy, engaging, and effective wherever students are.
To ensure sustainability beyond the pilot, the OSCE Ready Sprint Kit uses a hybrid model combining funding and revenue streams. We are starting with seed funding for prototype development supported by institutional partners like TUFH, UGHE, MedSAR, and working with educational platforms like Osmosis, Colorex, and Lecturio. We also aim for government support through the Ministry of Health and Higher Education Council to help scale and institutionalize the toolkit. On the revenue side, we rely on academic grants, sprint kit sales, and subscription model for premium content. Long term, we aim to integrate the toolkit into university curricula, making it both accessible and self-sustaining. Our implementation follows a four-phase plan to ensure a scalable rollout. Month 1 to 3, we will conduct needs assessment in 3 Rwandan medical schools and develop prototype Viva and OSCE modules. Month 4 to 6, we will pilot the sprint kit with 60 students from UGHE, UR, Asome, and finalize print materials, launch the website, and begin collecting ARI feedback. Month 7 to 10, we will use student input to refine content, start official launches in Rwandan schools, and strengthen partnerships. Beyond month 10, we will scale across East Africa, seek validation from regional councils, and develop advanced clinical modules. This initiative is led by myself, Ikuzwe Shaberozin, and Alex Ainebiona as project coordinators, alongside student representatives from other universities. We are supported by esteemed faculty advisors from UGHE, including Professor Daniel, Professor Abebe Bekel, Dr. Natalie McCall, and Dr. Patrick, as well as Dr. Hiba. Together, we bring student-driven innovation and academic rigor to this project. Thank you so much.
Thank you to our presenters. Again, a good collaboration. I'm looking here at the chat. Frank, you have your hand up. Go ahead.
Thank you so much. I would like to share my experience. My colleagues and I just carried out a study 2 years ago about AI use among medical students, and it was staggeringly high. So I would recommend that we already have an AI component that is embedded in this. Students are using much of it, and I would wish maybe as part of this program, we would come up with a study guide that students can use on teaching themselves through the different topics, like the key things they need to know, and then they can do that on their own. And then also to be able to include let me call it prompt engineering, but the skill of writing better prompts in order to get good results from the AI platforms. I think it would be a good enrichment for this project. Thank you.
Thank you, Frank. Alex and Rosine, you can collaborate with Frank if you want to follow up on his comments. Thank you for that. I'm now honored to introduce from SNO Faculdade Pernambucana de Suede from Brazil, Maria and João.
Hello everyone, my name is Clara Moreira and this is Brick by Brick, Empowering Youth to Lead in Science, initiative of SNO FPS Brazil. In Recife Tijolos community, fewer than 25% of youth finish high school. We believe every unfinished brick of education is a missed opportunity. That's why we're transforming classrooms into launch pads for long-term change, building bridges between science, health, and opportunity. To move forward, we are asking for 1,000 seed grant to fund our first year activities. Official endorsement as an FPS station project. The project is already aligned with FPS station guidelines. Partnerships with local schools and NGOs. And these three pillars, funding, institutional support, and community connection, will lay the foundation for impact.
Problem/gap. Tijolos faces three urgent challenges. First of one, education equality. Only 1 in 4 students completes high school. Health literacy void. Chronic conditions are rising while science education remains scarce. Opportunity desert. Despite scholarships from FPS to 1 physiotherapy student and 7 distance learners, most youth still lack mentorship and pathways to success. Brick by brick is our response, expanding FPS's current efforts into a full community-rooted program. Solution. Our solution is a 4-step program that aligns directly with FPS's mission to promote health and education. Spark. Weekly STEM and health workshops led by student monitors, introducing students to science and to FPS. Build. Hands-on mini projects that turn knowledge into action. Showcase, a community science fair and social media campaign to celebrate local achievement. Scale, train a new cohort of monitors and publish a playbook through the TUFH network. We move from curiosity to careers and toward health equity.
About our financial model. Our 1,000 seed grant will be distributed as follows. 400 stipends for student monitors, 200 community events and engagement, 150 marketing and visibility, others 150 contingencies like transport, internet, etc., 100 educational kits and materials. In addition, we benefit from non-monetary FPS support like classrooms, faculty mentorship, university platforms, and local partnerships. For year 2, we'll seek funding also from CNPq and PIB, extension scholarships, local sponsors like clinics and businesses, and TUFH Innovation mini grants.
And our timeline is structured across 1 academic year. From July to September, we will recruit monitors and run a baseline survey. To October to December, launch workshops and host our first science fair. From January to March, evaluate and refine our materials and curriculum. From April to June, train the next cohort and publish our impact report. Beyond, expand to new communities and share our playbook via TUFH. And about our justification of investment, we have the local impact, the sustainability and scalability and visibility, where we're gonna alignment with FPS institutional mission and the global health values of TUFH.
Perfect. And now we have our team. Our leadership includes João Lucas, physician and TUFH member, myself, Clara Moreira, nutrition student and legal intern at FPS, and also we are supported by our faculty monitor called Jessica Siqueira, 4 selected student monitors from 2 volunteers with capacity to scale up to 10 students later, community partners, teachers and health agents from Tijolos.
And Brick by Brick is more than a project. is a bridge to a healthier, more empowered generation.
With your support, we can help build that future, one brick at a time.
Thank you so much. We are welcome to your questions.
Thank you very much to Clara and Joel. It was really interesting. Another good collaboration, really showcasing community and how the focus is really on the community. What is that they need? Seeing lots of hearts, lots of applauses. I can see that there's an interesting topic to consider, investigation into the major reasons why the students don't finish high school. So that's something to take away while you prepare for implementation. And I'm looking forward in the next couple of months to get the playbook, to get the research, to see how the implementation is going. So great job. And I look forward to hearing how it's all going to run. I now have the honor of introducing Hannah Nagdi from University of Cape Town in South Africa. As you can see, we are moving all across the globe because that represents TUFH and SNO.
Hello everyone, my name is Hannah. I'm a student at the University of Cape Town and in South Africa, and I'm here to discuss the theme that I have for an SNO chapter to be established throughout Africa in the institutions called Towards Transformative Curriculum Change. So why is there this need for change? From a personal perspective, I've been political my entire life. I have a history of activism within my family, and I believe that everything is political, from your choice of food to where you get educated, to what you get educated on. Why we all need to be political is because politics represents the art of what is possible, and that possibility drives students to make change. We are in a world of ideological shifting, and this is shown through the youth rising to combat the systems they are in. And there are two examples of this. Greta Thunberg now going to university because it does not talk or focus enough on climate change, something that affects all of us. In South Africa, in the 2015 the Fees Must Fall movement, a national protest against high university fees that affected everyone. In terms of curricula in the apartheid era in South Africa, it focused on a more for westernized curriculum, not representing majority of South Africa's population. In post-apartheid South Africa, not much has changed in the curriculum, and it's still very Western. Therefore, now is the time for change for curriculum and student inclusivity as a result. So what is the problem exactly? The current state at UCT is that there's a fragmentation between health sciences degree programs. As much as there are curriculum change societies, they are not integrating together in terms of cross-degree movements, and they don't have enough manpower or global perspective to create relevant change. What is the current, how does it actually work in UCT? How does curriculum form actually work? Student voices in curriculum change are in the process of being properly established as we speak, and they do not have the manpower or global perspective from other universities to establish effective and relevant change. What we are trying to do is establish SNO chapters focused on inclusive curriculum reform. This will be, instead of creating a parallel structure that basically focus on curriculum change, will be integrating into student societies, into faculty boards to create meaningful change, to provide manpower, to provide an international perspective through SNO's social media, through SNO's people on curriculum change, to create relevant, effective change. So here's a bit of the goals of what we're trying to establish. The most important ones is building bridges between students and faculties for sustainable dialogue and using SNO's international credibility to drive awareness and legitimacy. In terms of how students can be involved exactly, there are various ways. One of them is being an interviewer or being interviewed for curriculum change if you are passionate about it, and interviewing faculty members about it. And this will be posted on the SNO social, so you can get a global perspective from other people within SNO on curriculum change and how it works with them. In terms of team composition, here are the various team compositions. The campus lead will most likely be the most active. Regional rep is the lead strategist, just basically overseeing everything, and the other faculty allies would be rather important as well in terms of staff partnerships, etc. In terms of the financial model, university resources will be used, therefore not much funding will be needed elsewhere. This idea is more based on ideological change rather than physical change, which is driven by youth and supported by the university and its staff. It's focused on building pride in your authenticity of your identity and focuses more on collective activism. What we're basically asking for is support through voicing your thoughts and becoming an activist to transform your curriculum for the better. University support and recognition of this platform will be appreciated to continue to make relevant changes. Here's a bit of the brief overview of plans, and the timeline to follow will provide a framework that other chapters can use to establish this chapter. I have established this in UCT, and we have done a couple things in this, including an interview and a podcast and various interviews with student societies. So why me? Why am I qualified to do this? I am passionate about politics, and I would call myself a student activist within my university. To do good and be good is my quote that I use. I believe in the good of others, and I believe that students can be passionate about systemic change when given a platform and a voice to do so. There's more you can read about me in terms of my bit of my background. And what I'm going to end this on is let's co-create change. Let's create meaningful changes, all become activists to create changes in the systems we are in, and join us in supporting transformative curriculum change today. Thank you.
Thank you to Hannah for a very passionate presentation on her topic. I'm very intrigued to see how the implementation is going to continue to happen, because you've already done a lot and you're continuing to do so. And I like the way that you've structured it in a way that it can be implemented elsewhere as well, whilst also taking into consideration how to get input from across the globe as well, because I think that is what it connects really TUFH and SNO alike, is the network of networks and the fact that we are international, that we are intersectoral, and that's something that we should definitely make the most of and use to the best of our abilities. So thank you again to Hannah. Seeing lots of applauses and hearts, seeing if there's anyone that wants to speak up or any particular commentary at this point. More hearts to follow. So I think people are very interested to see your idea come to life. So yeah, I'm looking forward to seeing how you're going to implement it and what is going to follow for it. I now have our second to last presenter, Walid Mohammed, who will be presenting SNO Sudan.
Hello everyone, my name is Walid Alamin and I am the national representative of SNO Sudan. I am proud to present our project titled Rebuilding Resilient Health Education System in Conflict Affected Sudan, Healing Education to Heal a Nation. The ongoing conflict in Sudan has severely disrupted the health education infrastructure, especially in rural and displaced communities. Thousands of students are disconnected from training opportunities. We believe that student-led efforts can drive the health education by rebuilding especially a rural and adaptive and inclusive health education system that can serve even in crisis. To make this happen, we are seeking academic partnership, digital platform, support and funding to 1. Develop an accessible training platform. 2. Train student volunteer. 3. Print and distribute physical booklet. 4. Deliver student-led workshop on the ground in affected area. In conflict zone across Sudan, health education is at a breaking point. Clinical training is inaccessible to thousands of students. Communities lack access to basic health information, and there are very few localized, context-sensitive learning resources. This leaves a major gap in building future health professional and healthy society. Our solution is a student-led initiative with three core elements. First, a digital platform for self-paced health learning using videos, quizzes, and case study. Second, peer-to-peer workshop in displaced and rural communities. And third, printed educational material for areas without internet access. All content will be co-created by students and reviewed by faculty. Our model is inclusive and low cost. It combines both digital and printed delivery. Content is student generated, supervised by academic mentor. We will collaborate with NGOs, global health bodies, and potentially the Ministry of Health. We all and we will measure success through improved access and engagement metrics and possibly social return on investment. In the first 3 months, we will train student volunteer and design the platform structure. In the next phase, we will launch a pilot with the online training and printed material. By the third quarter, we will conduct our first in-person workshop in internally displaced or rural area. By 9 months and beyond, we aim to scale to 3 or more regions and engage over 200 students in the initiative. Our team is led by myself as a project lead, along with a committed medical and health students from various universities across Sudan and involve all SNO Sudan local chapters, including Jazeera, Madani University, MST, and Durman University, and Al Ahfad, and else. We are supported by faculty advisors from partner institutions and are reaching out to collaborate with the local NGOs and international organizations. Our main objective is to rebuild accessible, super resilient, and student-powered health education system in conflict-affected areas, ensuring no student is left behind and no community is left uninformed. Thank you for your attention. We invite you to join us in healing education to help a healed nation.
Thank you to Walid. So Walid has the honor and the difficult task of uniting all of the Sudanese universities that fall under SNO Sudan. You've had a lot of interesting presentations from Sudan today, so I think Walid knows how to connect with them and follow up with them alongside working on his project. I can see some comments in the chat about looking at the different model for distributing learning in health professions, and there's a link there as well. And then lots of hearts and applause, as it's a very good presentation. There was a little mix up on the build of the screen, so his presentation was a little bit wider than was shown, but overall very good presentation, interesting project, and I'm looking forward to seeing how SNO Sudan will unite this project along with the other institutions in the region or in the country. And then last but not least, I have from the KLA University in India, Srinidhi Prabhun Sankar.
Good morning to each and every one of you present here. So today I'll be presenting our project Mithram, which is an SNO initiative program with the collaboration of my college of GN Medical College, Belagavi. So here is our project. Mithram is confident medication management for healthier and golden years. What are we asking for here is an institutional endorsement and branding from TUFH and the SNO in collaboration with our University of GN Medical College, a pilot partnership and funding in kind of support and professional help, especially in data security specialists and regulatory affair professionals. So what is our problem statement here? Is that we see there's an increase in the geriatric population and medication management difficulty, but there's extremely poor patient compliance, which leads to increased medication management issues. So technically in hospitals and clinics across India, there are a lot of medications which is being prescribed, but it has not been taken at the right time and the right moment. The compliance is really poor. This increases the disease worsening and hospitalization costs and increase the healthcare cost intent. So what we have here is an AI dispenser model, which is cost effective, has a real-time monitoring, which is not available in the already, is not there in the market. So right now, the available pill dispensers, the refill system is very cumbersome and requires manual sorting into multiple small compartments. So that is what we are solving here. So this is how our Mithram works. This is the blister pack and the tablet is falling down, which will be sensed by the ultrasound sensor and gives a real-time monitoring. We have applied for patent and this we have crossed the novelty check of our patent. So the addressable market is the aging population, chronic diseases, and to improve medication adherence. Revitalization of Mithram is by using real-time monitoring, data analytics, automated medication sorting and pharmacy tie-ups, telehealth integration, biometric authentication, and medical inventory tracking. We stand apart because there is no available AI dispensers in the market, and the ones available are too expensive, and none of them have real-time tracking, or there's no AI or data analytics. So according to the market comparison, there is around 15% CAGR per year, which is set to reach 5 billion by the year 2028.
Abigail, come in, come the leather, come, bring it.
So our business model here is to produce in small batches and give for testing in hospitals and clinics. There'll be a subscription plan for smart tracking, alerts, and refills to the app system, and the revenues will be earned through the healthcare providers and consumers, which will explore partnerships with government programs and social initiatives. So this is our 2-year action plan where we aim to set pharmacy tie-ups by 2026 and go for a regional launch by April, scale up the distribution by July 2026, and robust customer support by December 2026. Finally, this is an image of our prototype, our initial prototype, and I would like to introduce our team members as myself and my mentor, Sulakshana ma'am from the Department of Community Medicine of my own very college. Thank you so much.
Thank you to our last presenter, Srinidhi. I'm looking at the chat. I'm seeing lots of thumbs up. I'm seeing hearts. I'm seeing applause. So another prime example of a SNO chapter, a different focus now, aging population. So I like the, the fact that we've seen all different targets. We have come almost upon the time, so I want to just give the honor to Ibn Omar from the SNO Executive Committee to provide some closing remarks along with Bill and Nick, and then we can conclude. Thank you all. Ibn Omar, can you speak up?
Thank you, Arisha. Hello, everyone, esteemed TUFH members, the honored guests, and the most importantly, the graduates of SNO Leadership Institute, the class of 2025. And today we celebrate the culmination of your journey, a journey of dedication, the collaboration, and the profound growth. So look around you. You are the network today, the community, and the living embodiment of our mission toward unity for health. You arrived here as students, and you leave today as leaders. These programs challenge you to solve real-world problems and to build bridges where there were gaps. You learned that true leadership in health isn't about the individual success, it's about the power of unified network. The world's greatest health challenges today can't be solved in silos. They require students who understand the policy, the researchers who listen to the communities, and advocates who can speak the language of data. As you step into your career, carry this charge with you. Firstly, be the bridge in every environment you enter. Be the one who connects the people and ideas. Secondly, lead with empathy. Never forget the human story behind the statistics. Third, as you learned, be brave enough to ask why and innovative enough to propose what if. And finally, stay connected, and the network is your most valuable asset. Lean on each other's with support of each other's always. We have seen your dedications and your impact. We are incredibly proud and have no doubt that you are ready for the challenges ahead. So the world needs your leadership, and now you can go and lead the way. Abdurrahman Ibn Omar, on behalf of Students Network Organization EC 2024-2025.
Thank you, Ibn Omar. Bill?
Thanks. First, thank you, Aricia, and thank you, Nick, for putting this together. This is exactly the kind of program that TUFH should be doing. The students are the future of our organization, so thank you. It's wonderful to see some old friends online. I'm looking at some of them now. having been in some of our classes together. But as Abdel Rahim has just mentioned, the point I would emphasize is that the group that you see in front of you online is your support network. It's your idea network. And I encourage you to be connected. You are in all parts of the world and not necessarily connected before this call, but now you have an opportunity to question each other, to look for ideas. You can't do this by yourself. So look to others for ideas and maintain that social connection. So again, thanks, Aricia and Nick. This is fabulous. I really appreciate your inviting me.
Thank you, Nick.
Thanks, everyone, and special thanks to the students. It takes a lot of work to take these ideas from just where you started, driven by your passions, to where you ended up today, and the thinking that went behind it that will live with you forever. So whether you drive this through a SNO chapter within your university, or if you take it outside of it when you graduate and go off, this type of thinking, this process is very important. But thank you for all the tremendous amount of work. And I hope that these SNO chapters take root within your institutions and you bring lots more students involved based upon your interests and your passions. And thank you for everything. Great job.
Thank you, everyone. And we look forward to hearing how these SNO chapters will evolve in upcoming newsletters and as we stay together and attached. So yeah, looking forward to stay connected and see how you grow. Thank you for all your participation and congratulations to our graduates of the SNO Leadership Institute 2025. Have a wonderful day, everyone. Bye.
Bye. Thank you so much.
Thank you so much.
Thank you.